Welcome back. Many people across the country are feeling the pressure of rising prescription drug costs, now worsened by inflation. As a result, patients are avoiding their medication altogether, and skipping prescriptions can lead to poor health outcomes and even higher healthcare costs in the long run. However, there may be a solution to avoiding expensive drug prices. Chief Health Officer at Optum Perks, Dr. Jenny Yu, now joins me to discuss ways you can make informed decisions about healthcare costs. Doctor, I want to thank you so much for joining us.
Thanks, Kibin, for having me on today.
Now, can you tell us about the organization Optum Perks and some of the work that your organization does?
Yep, so Optum Perks is a prescription drug savings program that is available for consumers really to understand more about drug costs and then the available discounts that are out there so that they can make informed choices before they head to the pharmacy.
Now, can you share the latest information revealed from a new survey that found Americans aren't checking prescription prices?
Yeah, and over 1,000 respondents, adults who are either filling a prescription or refilling prescription, 61% of those folks don't actually check drug prices before they head to the pharmacy. And for even those who do, they're confused in terms of the costs and just really what available discounts are out there. So when they show up to the pharmacy, they're often experiencing that sticker shock. And as a result, 1 in 3 Americans who are of low income and in particular on a budget are skipping filling that prescription. And as you had mentioned, those can have long-term effects in terms of not taking the medications that are needed and resulting in more complications and possibly higher healthcare costs at the end of the day.
Now, I think this is so interesting because I think that myself and probably so many other people included had no idea that this was something that you could even check, that you can even see, what the prices were. Can you just talk about the impact of not comparing or looking at drug prices on the amount paid at the pharmacy?
Yeah, and I think drug prices probably are not in the forefront of people's minds. They're certainly looking at prices of other things, and I think that's the information we want to get out there is for people to realize that there are differences in terms of drug costs, and that varies widely across different retailers and pharmacies. And by doing a little bit of comparison shopping, using an app or a website that's part of the prescription drug savings program, you can then have an understanding of what particular medications cost what in terms of what pharmacy you're going to in your particular area based on your zip code. And having that and having those discounts available to you if you're on multiple medications, whether you're managing diabetes or high blood pressure or the various things that require multiple medications, having that ability to save a couple bucks will add up over time.
Now, as mentioned, high prices are forcing some Americans to skip their prescriptions. Can you just talk more, about this, I guess, harsh reality that a lot of people are facing where they have to either choose their health over, I guess, their livelihood, which is, kind of similar, but clearly, I guess one has more of an immediate impact. So can you just talk about that?
Yeah, I mean, I think the cost of inflation are going high. Whether we're talking about eggs or milk, these are items that you need, but you can make the decision in terms of whether I'm buying that today versus a week later, looking at the cost. And unfortunately, with drugs, with that high cost, people are making that decision. However, those decisions then can affect just overall the effects of the drugs in terms of knowing people who potentially are stretching out how they take medications or cutting it in half of a dose to kind of stretch out how long the drugs are available to them. And they're just and these are just the unfortunately harsh reality of our times right now. And I think we want to be able to have people understand that there are discounts that are available to them, and they should utilize it. And whether they can access it themselves or have family members and caregivers help them, it's there for them. So they need to look for it.
Now, prescription drug prices can vary depending on the pharmacy. Why are the prices so different?
Yeah, and I think that just has so many different factors in terms of what contribute to it. Just like when you compare a household item, in one particular retailer compared to another, it differs whether it's based on volume or sort of the buying power and the contracts. And I think that's the same thing with medications and drugs that they can vary widely of this way. And with Optum perks, that utilizing the sort of buying power and leveraging Optum RX. This is a consumer product that allows people to find the right information and the right discounts to them.
Now, can you talk about the prescription drug savings programs, how that helps with costs? How can people find these programs that help with, I guess, getting their medicine at the pharmacy?
Yeah, so this is a discount program that you sign up, and it's very similar to sort of promo codes of the early e-commerce days, where you're looking to find a discount code that you can use at the checkout. Similar in that way, in that there are these discounts at no cost to you, no sort of commitment, but it's just in a place where you can find the information for comparing the drugs, as well as the discounts, and by signing up then you have sort of a full view into, the many thousands of drugs and what the costs can look like across, and what it means to, go to that pharmacy of your choice. And maybe there's a pharmacy just down the street that's a little bit cheaper in terms of that medication you're looking for. So it allows you to be able to find the information to compare prices and then realize the discounts that are available to you.
Now, I'm really interested in understanding, I guess, your perspective in this entire situation. As I mentioned, people sometimes get forced to just skip their medications altogether because of the price. How does that make work as, for healthcare professionals like yourself, maybe more of a challenge?
Yeah, and I think we're seeing the kind of the long-term effects of people who are not filling their medication when they're asked to, and when they come back with sort of the same problem or further severity or complications as a result, then it's one of those things where you're saddened by the choices that people have to make, but you also want to make sure that you give the right information for folks. And oftentimes, people are calling their doctors' offices as well to find information about medication, and at times they're not getting that information right away, where they're already at the counter at the pharmacy, and when they realize that they have to make that choice. It's just more convenient and easier before hearing back from the physician's office than to just leave. And I think, a prescription savings program and having that information, we all carry a phone and have that convenience, and knowing the prices. I think it just helps people to make the right choices without having to sort of leave because they just aren't able to afford it.
And I think this kind of perfectly leads into my next question. Can you just talk about the work you do in health literacy? And, I think this is just more than just going to the doctor. What can people do to make sure that they're educated about their personal health?
Yeah, I think once people can feel like they can take some control of their healthcare journey, it can help them to motivate them to do the right things. Oftentimes, people find medical information to be really complex and hard to understand. And I think it's important to write medical information in a way that helps people to feel like it's relating to them and that's speaking to them, and that they can understand it so that they can take action in having that information. For me, when I was in practice, just having people to understand, and oftentimes they don't realize that the information's out there, and for them to find relatable information, whether it's managing a disease or understanding some of their symptoms or even how to navigate healthcare, it really helps them then to make the right decisions and take the right actions.
Well, doctor, I want to thank you so much for joining us and educating our viewers about this.
Well, thank you for giving me the opportunity to.
If you are one of the many Americans affected by the rising cost of prescription drug prices and would like to find out more about this amazing program, please go to their website at www.perks.optum.com. We've come to the end of our show today. I'd like to thank all of our guests for joining us and you, the viewers, for tuning in. If you missed any part of today's show, you can catch the recable cast at 5 and 10 p.m. on Optimum Channel 67 and Verizon Files Channel 33, or watch anytime on the web at bronxnet.org. You can catch a brand new episode of Open with Darren Hymie on Wednesday and with Rena Valentine on Friday. I'm Kibin Alleyne, wishing you and yours safety and wellness now and always. See you next time.